This is a really important video. Please watch this, okay? When you take estrogen orally, look at this graph. That purple line, that's estrone, E1, that the estradiol pill is converting into in the liver. Everything you take in through your stomach, before it can circulate through your whole body, it goes to the liver first, and that's called first pass liver metabolism. So this little estradiol pill that your doctor gives you, look at how much of it is converted into estrone. You take a 2 milligram pill, you get 50 picograms per milliliter of estradiol, and then 350 estrone picograms per milliliter. Yeah. So 400 picograms per milliliter of estrogen, and only 50 of it is the one you want. And the other 350 is estrone, E1. Your doctor doesn't know this, which shouldn't surprise you. If you've been watching this channel and other channels long enough, it should not surprise you. Okay, so what do you do about this? You take a transdermal estradiol instead, or an injectable. You can do your injectable estradiol with an insulin syringe into your fat. It doesn't hurt, and you still absorb all the medication. The only reason your doctor tells you that you have to use a 1.5-inch 21 gauge needle is because, once again, they don't know how any of this stuff works. They're blindly following what they were told, and the drug manufacturer always says 1.5-inch 21 gauge needle into the freaking thigh muscle. Ow. You don't have to do that, okay? You can take an insulin syringe that's 1/2 inch long, 29 gauge, it's so thin you can barely feel it. Inject it into the fat of your hips, your shoulder, wherever, and it's painless, and it's not a big deal. Do that instead. Don't take an oral pill. Look at this. Let's say you wanted to get 100 picograms per milliliter of estradiol, you would have to get 700 estrone along with it. So why am I making such a big deal about estrone? Here is a study on PubMed. The effect of estrone on thrombin generation may explain the different thrombotic risk between oral and transdermal hormone replacement therapy. So we've seen studies that show oral estradiol pills are increasing clotting factors, thrombin, thrombolytic events, deep vein thrombosis, venous thromboembolism, all these terms you hear. And then we sit back and we say, well, why would estradiol cause any of that? That doesn't make any sense. I mean, estradiol doesn't. Well, now we have a clue here why it would happen. So we'll start at the beginning here. The metabolism of estrogen contained within hormone replacement therapy is influenced by route of administration. That means pill, injection, or gel, or suppository. And so this affects the risk of venous thromboembolism, which is a fancy word for getting a blood clot. Thrombin generation, a global coagulation assay, is a marker of hypercoagulability and is of potential use in determining the thrombotic risk associated with a particular route of administration for HRT. The objective of this article was to determine whether any effect of oral and transdermal HRT on thrombin generation was related to the plasma estrogen profile. They investigated the effects of oral, transdermal, or placebo group, looking at thrombin generation, which is the standard marker of thrombophilia, and then estradiol level and estrogen level. All parameters of thrombin generation were altered in the women using oral HRT compared to placebo. But the women using transdermal estrogen were equal to placebo. There was no increase. Estrone levels correlated with the peak thrombin generation in the women using oral HRT, but there was no correlation in women using transdermal. Thrombin generation is significantly increased in women who use HRT administered by the oral route. This is probably mediated by the hepatic first-pass metabolism of estrone, the main metabolite of oral estradiol, which is avoided by the transdermal route. When you see the word hepatic, they're referring to your liver. So it goes into your stomach, liver, then to circulation. But if you do injection or transdermal, straight to circulation, no liver. So then the estradiol stays pure. It doesn't get converted into estrone. So then now you have no clotting risk. Isn't that something? But yet, what do like 99% of all family physicians give to patients? Oral. Every time. The effect of estrone on thrombin generation may provide the explanation for the higher thrombotic risk seen in women using oral instead of transdermal. So there you have it. I don't like being the bearer of bad news, but I really want this information to get out, and I want you to have it in your toolkit so you can think about these things when you're making your decisions. All right. See you guys later.